Did you know that 1 in 3 women over 50 will break a bone? Not from a serious accident, but from something as simple as a minor stumble, a sneeze, or just bending forward because their bones have silently become too fragile to withstand everyday forces? And if you're being treated for breast cancer, your risk is even higher. This series is going to change how you think about your bones. Welcome to the Bone Health Series. I'm Dr. Monica Relfus, a physician board certified in lifestyle medicine and obesity medicine, and I have advanced certification in hormone replacement therapy and cardiometabolic health. Whether you're a patient, a survivor, or a healthcare professional, these videos are for you. Let's start at the very beginning. What actually is bone loss and why should you care? Most of us think of bone as something solid and static like concrete. But that's completely wrong. Your skeleton is living tissue that is constantly being broken down and rebuilt every single day for your entire life. Here's how it works. You have two key types of bone cells. Osteoclasts, think of these as the demolition crew. They dissolve old, worn out bone tissue. Their job is to resorb or break down bone. And osteoblasts, and these are the construction crew. They build new bone to replace what was removed. In a healthy adult, these two teams are perfectly balanced. The demolition crew and the construction crew work in harmony. Bone is removed and replaced at roughly the same rate. Your skeleton stays strong. The process is called bone remodeling, and it happens constantly, especially at areas of stress and repair. Now, the critical regulator of this whole system, estrogen. Estrogen keeps the demolition crew, the osteoclasts, in check. It slows bone breakdown. When estrogen levels are high, bone remodeling is balanced. When estrogen drops, whether through menopause, cancer treatment, or other causes, the demolition crew goes into overdrive and the construction crew can't keep up. So, how do we measure how strong your bones are? We use a scan called a DEXA scan. It's called dual energy X-ray absorptiometry. It measures your bone mineral density, or BMD, at key sites, the lumbar spine and the hip. Your result comes as a T-score. It's a comparison to the bone density of a healthy young adult woman. Here's the scale. T-score above -1 is normal bone density. T-score between -1 and -2.5 equals osteopenia, which means low bone density. Your bones are thinner than ideal, but not yet quite in the danger zone. Think of it as a yellow light. A T-score below -2.5 equals osteoporosis, and this is the red light. Bones are significantly weakened and at high risk for fracture. Osteopenia is often called pre-osteoporosis, but that can be somewhat misleading. Osteopenia can still cause fractures, especially if you have other risk factors. It should not be dismissed. Osteoporosis affects an estimated 19.7% of women globally. And here's the scary part. Most people have no idea they have it until they fracture something, often a vertebra in the spine, a wrist, or a hip. A hip fracture in an older woman is not a minor event. It carries significant risk of long-term disability and death. This is why we screen and why we treat. Who's most at risk for osteoporosis and fractures? Well, let's talk about the key factors. First, the non-modifiable risk factors. These are things that you cannot change, like your age, which leads to bone loss that accelerates after menopause, a family history of osteoporosis or hip fracture, a personal history of a fracture after the age of 50, early menopause, which happened before age 45, being of white or Asian ethnicity. And there are modifiable risk factors, things that you can change, like low calcium or low vitamin D intake, physical inactivity, active smoking, drinking 3 or more standard alcoholic drinks a day, low body weight, which is less than 127 pounds or a BMI lower than 21, long term steroid use more than 6 months. Now, for healthcare providers, when we talk about breast cancer patients on aromatase inhibitors, these risk factors are additive to the bone loss caused by the treatment itself. This is why formal risk assessment is essential. So now you understand the basics. Bone is living tissue, estrogen is the key regulator, and bone loss happens silently until it's too late. In our next episode, we are going to talk about why breast cancer treatment, specifically aromatase inhibitors, puts women at such dramatically elevated fracture risk and what the data actually shows. Don't miss it. Share this with someone you care about. See you soon.